On this episode of Putting Possibility into Practice, we're talking about an expansion of your practice and how you can integrate Greenway Intergy when you acquire additional practices to help grow your own practice. Plus, you've heard about hosted services from our Chief Information Security Officer, Larry Whiteside. Now, hear about hosted services from the customer's point of view and what are the advantages of being on Intergy Hosted. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager here at Greenway Health, and this is another episode of our podcast, Putting Possibility into Practice. And I am joined by Eric Ruff, the CEO of Barbour Community Health. And Eric, thank you for taking the time to join me on this episode of our podcast today.
Happy to do it. Looking forward to our conversation, Joe.
And as we talked about in the introduction, talking a little bit about Greenway Intergy and what it means to be hosted and having hosted services. But first, before we get into the nuts and bolts of that, let's talk a little bit about the practice, where you're located, services, specialties, the size, the providers, all the good stuff that people may want to know.
Very good. Sure. Barbour Community Health is located in Barbour County, West Virginia, fairly rural community. I think we have about 17 or 18,000 in our county, so pretty small county. We have locations in the two larger cities in the county, in Belington and in Philippi, pretty equal in size as far as patient volume and providers and so forth. So we end up serving about 12,000 patients annually, so we serve a significant portion of our county population. We're primarily family practice. We have 14 medical providers here between the two locations, and then we also have 5 behavioral health providers. Also, interestingly enough, we have a clinic at our local high school. We have one high school in the county, and so we have a school-based health center. And then we, about a year and a half ago, started serving a small private college also in the county. Alderson brought us, and we placed a small clinic up on that campus as well to serve the students and staff at Alderson Broaddus University. Between close to 20 to 25,000 encounters annually for our practice as a whole between all sites. The two sites, it's interesting, had been competitors for many years. One, the Myers Clinic, and two, Belington Clinic, and then joined forces a couple of years ago. And the Myers Clinic had been in existence for about 85 years, and so had served the community of Philippi for all those years as a private practice, a family practice, and then as a rural health center, and now as an FQHC. Belington Clinic has served Belington community for about 45 years now, and was a satellite clinic of a local hospital not too far from us that eventually had to close its doors, but the clinic itself remained operational due to some local businessmen wanting to keep it in town, and kind of took over the operation 40-some years ago. So it's kind of who we are quickly, and I certainly could tell you stories for hours if you wanted.
Certainly someday maybe we'll do that. But for our listeners here on the podcast, we'll get right to the details. Talk a little bit about, and it talks about the acquisitions and growth. Before we get into integrating systems, talk about your partnership with Greenway, why you chose Greenway and the Intergy platform.
Yeah, we go back to about, we kind of started the process in 2010 is when we started looking at systems. We were coming straight from paper into the EHR world, decided it was time to do that. And so we shopped around, and we ended up kind of narrowing that down to two systems, and had folks come from both companies in to show us their system. And, there were pros and cons to both, and ultimately my medical team and my administrative team decided that Intergy was the platform we wanted to go with. That actually predates Greenway. At that time, Sage was the company that was managing Intergy, and it's gone through some changes as company has merged or so forth. And we've been real happy with it. We have, of course, the EHR, the practice management, and the practice analytics pieces of it. And it's been a good tool for us. And up until just a few months ago, we've actually had the same trainer all of that time that's worked with us and taught us and helped us do setup and all of those things. It just seemed like a good solution that was affordable for our organization. And again, overall, the entire staff from registration to providers have been pleased with it.
And then as you have grown and there's been acquisitions, as you alluded to, how has Intergy integrated with the practices that you've acquired?
Well, when we acquired Myers Clinic a couple of years ago, they also were a customer of Greenway and Intergy and had that platform, and which I thought was a great sign. I thought, hey, this will be great. Won't really have to, pick or choose between two systems. And so, it was a no-brainer for us to just figure out how to merge the two systems. We had a team from Greenway that helped us through that process, that worked with us. And, I won't say everything was perfect. There were a couple little bumps along the way in that transition, but it ultimately went well. The data transfer went good. We ultimately moved the data from the Myers site to the Belington site into that server, and just brought over all the data, patient records and demographics and records, and the imaging was probably a little more of the challenge for us, but that's all been worked through, and it's been a good thing. The only other challenges we had through that really had to do more with us on the local level, and, because Intergy is such a flexible system and there are multiple ways to do things, it became a matter of trying to get the staff accustomed to, how you code things, or the code you assign to providers and insurances and all of that. We had to come up with a system that made sense for both sites and be willing to make that change. But as far as the base of everything, it seemed to go well. It seemed to, and I was grateful that we actually were merging with a site that already was familiar with Intergy.
And in regards to Intergy now, I understand you've become a hosted client. And in a previous episode of our podcast, I was joined by Larry Whiteside Jr., who's our Chief Information Security Officer. So for our listeners who want some more details on hosted versus on-premise services, I invite you to listen to that podcast. But why did you choose to go the hosted route for the practice, and your experience with it so far?
A lot of it was driven by the fact of the merger with the other organization, because I wanted to make sure we had a way that all four of our sites, clinical sites, could access the system and get to it. And we initially were trying to host it just at the corporate site here in Belington, and I was concerned about the speed. Like a lot of rural communities, our internet's not the most reliable, and it's not the highest speed, and it's got some issues, and so I became really concerned about that. And how are we going to have all of these employees? I've got 80-some employees, and all of these providers. I want them to be efficient and be able to work and not have to sit and wait. So as I talked to our representatives that we work with at your company, Greenway, we really started talking about the hosting, and it just made sense. And I was a little hesitant, and she would tell you that again, because of the internet speed, I was really concerned that, oh my gosh, what happens if the internet connections breaks to the hosted service? So we did invest in some high speed and fiber and with the local company, and finally got that all fixed, and the hosted's been wonderful. As a matter of fact, the greatest testament I had when we finally went live on the hosted was I have a PA that works for us. He's 77 years old, and he's probably been the most resistant to electronic records of anyone. But I went in and I said, "How's it going?" And he said, "Well, it's faster than it was before. This is great." And so it ended up being a great thing for us. And given our rural location, we did have to invest in that, that fiber connection to really make sure that it worked well. And it's been wonderful. We do have providers that like to chart from home, and the fact that it's just a matter of logging in as long as you have an internet connection has really, I think, helped them out and made them feel better about what they're doing. No, also less vulnerability, I think, with our data. We know our data is protected; it's there. And barring, you hate to think about a tragedy, but should something horrible happen in the building where you have a server sitting, unfortunately, even though you're backing data up off-site, it could be devastating if you aren't, if you have one of those tragic situations happen. So this has been a wonderful solution for us.
And what advice would you have for practices who maybe are considering hosted services?
Just do your homework. I think it's important, again, that internet connection and reliability, having a backup internet should something go wrong with your primary internet source. That's really the main thing you have to be concerned about, because it's been very reliable. I can think of very few occasions in the last year that we had any issues, but with it being hosted, we've also found that if a little problem does arise, it gets fixed so much quicker because the team is right there with Greenway that needs to address any issues that maybe come up. And the most I can think we've ever been down was, I think, for 10 minutes. A few months back, something had happened and things kind of went down for 10 minutes, and that's not bad at all. By the time we had figured out what we were going to do, everything was up and running again. And so just do your homework and make the investment. I think it's well worth it, and wish I had done it years ago.
And then we've talked so much about the acquisitions and the growth. Where to from here for Barbour Community Health as you look into calendar year 2019 and beyond?
Yeah, it probably would, at least in my attention, is on behavioral health. And, my goal for our use of Intergy is to really make sure that we're using Intergy in the best way and most efficient way possible for our behavioral health services. Those notes are important, but mental health providers have a little different way they like to document visits and drop charges and do things like that. So we just want to make sure that we're using the system the best way possible for them. We've looked at some templates that are in there for visits, and we might have to do some editing and working with one of the Greenway reps on that to get it to where our mental health providers would like to see it. So that's a biggie for us in the coming year. The data collection, since we're a federally qualified health center, we have the UDS reports. We've been working closely with Greenway to make sure all of those reports are coming across accurate and just making sure we're clicking the right boxes and documenting things in the right places so that it pulls that data into those reports. Again, that's some training needs on our part that we'll continue to work on. Down the future, I think there's an opportunity for our organization for dental, and that's something that we would probably have to start taking a look at, whether it's a partner that Greenway would have to provide some sort of software for dental, or whether in the future plans of Greenway, if you all have plans of some sort of dental software, and that's probably 3 to 5 years out before we get there. But that's kind of our looking ahead growth opportunity, I think.
Great, Eric. Well, thank you for taking the time to talk to me today. I've really enjoyed our conversation, and certainly hope we get to catch up again for another episode of our podcast, Putting Possibility into Practice.
Very good. Thank you, Joe. It was a pleasure talking to you today.
Once again, that is Eric Ruff. He's the CEO of Barbour Community Health, as we talked about Greenway Energy and Hosted Services. For more information on Greenway Intergy and Hosted Services, I invite you to visit our website at www.greenwayhealth.com. Once again, I want to thank my guest, Eric Ruff, the CEO of Barbour Community Health, on this episode of our podcast, Putting Possibility into Practice. And if you've enjoyed what you've listened to today, you can listen to past episodes and subscribe to our podcast to get notifications of new episodes each week on your platform of choice. We are on iTunes, Google Play Podcasts. We're on Stitcher, TuneIn Radio, iHeartRadio, Spotify, Libsyn, and SoundCloud. For now, I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and this has been another episode of Putting Possibility into Practice.